Hello, Pasem Afro community. My name is David Jolly Muganzi. I'm a medical doctor and I lead the team at the Pasem Afro Secretariat as the chairperson. Pasem Afro is a community of health professional students across Africa that is working to advance the quality of healthcare on the continent through promoting patient-centered care. The Pasem Afro community has students from over 16 universities in 8 African countries who are working on various activities to enrich themselves with knowledge about patient-centered care, but also to get the skills to deliver this care. Beyond that, our community works to provide thought leadership in their hospitals and the different people that are in charge of our healthcare. The other thing that Pasem Afro works on is research and innovation. And last year we started our very first journal club where members of the community are learning about research in the field, how to conduct the research, how to read research papers with a patient-centered care lens, and how to get questions that will give us answers to advance the quality of healthcare on the continent. Beyond that, each of our chapters carries out different activities like training, symposia, quizzes. They are very innovative things that the people in the community do. Additionally, we have a conference, the annual Patient-Centered Care Conference in Africa. The very first one happened in Makerere University in Uganda, and the second one is going to happen in February 2025 in Kenya. Our work has grown over the last 3 years, and that is what has led us to this podcast. And with me, I have my friend Imi, who will introduce herself.
Hello, Pasem Afro. My name is Immaculate Atim. I am a medical doctor by profession and also the director of finance at Pasem Afro team. So as David mentioned, we are working on this podcast. The main reason we have a podcast is because as Pasem Afro, we realize there is a big gap between the patients, that can be us, even as doctors, and the healthcare system. And when I say gap, there are stories that have not been brought behind or has not been brought to the general public. There are stories of diagnosis, that how a patient has received their news from the hospital, how did it affect them? How did the doctor think of coming to this prescription, or how did they deliver this information? Are there things that doctors do sometimes that they are not aware that it affects the patients? And are there things also as doctors would love for patients to do differently? Or are there questions we want patients to ask us and sometimes they don't know? Do the patients know their rights? So that we realized there was a gap in these conversations that are not being had. And we thought that since our work is around patient-centered care, why not have these conversations and see how we can change the narrative of healthcare, improve quality of care through conversations and stories. So if you've tuned in and you're still listening, expect to hear stories from the field, expect to hear patients on this podcast, expect to hear doctors, expect to hear nurses, and just sharing stories about their experiences in the hospital and even outside the hospital. Follow up. When we go to the community, these patients doing the preventive things we ask them to do back at home? So basically, that's what the podcast is going to be about. Do you have anything to add?
Yeah, like I shared, what Pasem Afro is doing is getting people to think differently about what healthcare is. And in the patient-centered care lens, health is beyond just disease and not having disease. It's the person, it's the work they do, it's their family, it's how they perceive things. We know that one of the biggest hindrances in healthcare is getting people to change the way they do things. And yet that is some of the most impactful ways of changing people's healthcare. Getting people to stop smoking, getting people to adhere to their medicine, getting people to stop drinking alcohol or to do things differently. And sometimes it's not because they don't want. Sometimes it's because we don't know them very well, or it's because of things we do unconsciously. And these things hinder the care that we deliver. So with that, I'm going to start with a story about a friend who got me to think about the things that we do unconsciously as doctors. So I love sports. And one of the sports that I do is swimming. A while back, after a couple of laps in the pool, I noticed that my friend was holding their abdomen. And I'd seen this happen a couple of times. So this time I was curious. I was like, do you feel so much pain after swimming, or is there something wrong? So he said, oh, don't worry. There's nothing wrong. It's just trauma. I had a surgery about 3 years ago, and up to now, I feel a certain way when I'm after working out or doing something strenuous. So I asked more, and he let me know that he had a surgery about 3 years ago, and it was more of a prophylactic surgery. He had a small hernia. It had no medical implications by then, and the doctors told him he could go on without having the operation, but he requested to have it. So he had the surgery. He told me it was about less than an hour. But 3 years later, this experience still affected how he's working or how he's living, which kinds of exercises that he chooses. And the real thing that impacted him was not the surgery. The real thing that impacted him is how he got into the theater. He told me that as they were rolling him into the theater, they were rolling out someone on a bed who had just died. And the nurses were talking about how he died. If you've been in a theater, you know how tense it is when a patient dies on table. And sometimes maybe we unconsciously talk about it even when we are getting someone.
I feel like
theater.
It's because we are used, not that we are used to death, but then when you're in a system where, let's say if you're working at the emergency unit, trauma has happened, there's an accident and it was very bad, you're used, oh my God, you've tried your best, they didn't make it, talk to their relatives, move on, because people will do last office and go and take tea. So you're kind of used to it, and then you'll just talk about it, because this it's a coping mechanism for the nurses, like talk about it, laugh, and move on, but not knowing that probably someone is around. I don't know. Well, did he listen to the nurses say it? Was he awake?
So to say, he was awake, and he got to know that this person that is getting out from where I'm going died.
On the same table they're going to work on him.
I think, yeah. So this thing has stayed with him for the rest of his life. Like, I think up to now, because the surgery was simple. He said within a week he had recovered, he was able to walk, but up to now, he still feels like he's near death because of the surgery that he had. For him, that's the image of surgery in his head. Yeah. And I sat down and I was like, how many things do we do unconsciously that affect patients? And what can we do differently is the real question. And I hope that this podcast...
Anyways, so I feel like your friend can never do surgery again. Like, he would be so traumatized to enter into the OR, or if his relative is going for surgery, I don't know. Is he getting help?
I don't know. I don't think he's getting help or something like that. We talked about it, and I think also being a guy, he's manning up or something like that because of
mental health.
Because of the way our society is and how. So he probably had never talked about it to anyone until when I asked. Yeah, so I think that is an effect of healthcare. Like, they repaired his hernia and damaged his psychology and unconsciously. And I hope that we try to see more of these things and do differently. Yeah.
I think for me, what I've seen sometime when I was volunteering somewhere, was that there are certain things people normalize as, that's my character, that's just who I am, but they affect healthcare. For example, there was this mother who had to get medication for her child. But then I think the nurse that was giving the treatment was at times rude, very rude. And there was a time I think they quarreled. And the mother came and said, Doctor, me, if it's that nurse giving treatment, I'm not going to get the medicine. Let me just carry my things, I go back home. Then later we had to now talk to her, it's your child that is here, you need to get well and stuff like that. She said, no, I'm not getting medicine. So after talking to this other health worker, she says, me, that's how I've been, and and we're like, no, you have to try to work on yourself to be better so that the patients can get medicine. Because now if someone is not getting treatment, yet they came to hospital to get treatment, because of your attitude, it's a problem. And in medical school, we are taught knowledge, we are taught skills, but attitude is not taught. It's something that someone has to build along the way. So that's mostly to the health workers. So with time, she became better. I left the place, but then I understand she's now better. And now people are getting treatment somehow. But that's subconsciously, you think that is just who I am. But then attitude is something that you can work on with time. I don't know.
So in a way, as a health professional, you also have to have the skill set of being an actor. Like, you see how actors can have a different personality on the movies and a different personality in real life. Maybe like it doesn't matter if you are what kind of attitude. Some people who are, let me say, they're straightforward. Me, I don't pass through the corners. I just tell you what's up.
But there's a way you can tell someone what's up in a kind way.
Yeah.
In a polite way.
So the thing is that maybe health professionals, we have to, like when we put on our lab coat, in a way we have to put on a certain kind of attitude that goes with that.
Actually, what I tell myself, because there are times you've done a long shift, you're very tired, and then you see the next patient and you're just like, you're just drained. So I just tell myself, if this person was actually fine, they would not be here. They actually need my help. So let me just, whatever, I'll be fine. So you brace yourself, because if people don't need help, they'll not come to you. If my phone is not cracked, I'm not going to go to the one who is repairing phones to get help. So yeah.
Talking about after long shifts has reminded me of a time, and I think that's something that that can be a good remedy, to be aware of yourself, that now I'm tired or now I've become grumpy. And then maybe you take a step back or ask a colleague to step in. And I think it should be a valid reason to take off like 20 minutes. And you say, I think maybe you're at an OPD and there's a long line. And then you see a patient and you just reflect and you're like, you know what? I think I was grumpy with that patient.
Let me first take a break.
I'm tired, so let me take a break. And you
I'm
let
hungry.
your colleagues know, you know what? I'm not helping.
Let me step out.
I may clear the line, but I may be creating more harm. So let me step out for 20 minutes and come back. I think that is something that can help us. Yeah.
But also sometimes we try to be diehards. Like, no, I have to clear this line, and I go one time. Like, you try to be so strong, but then at the end of the day, you're not helping anyone if you are broken. Let me see. What have I personally done subconsciously that I think has affected care? I think when someone comes to the hospital, because you're used to the hospital, you're used to the laboratory is this side, the radiology section is this side, and then someone comes and she's like, Musao, I'm looking for the laboratory, where is it? And you're like, now you just take left, take right, then you see a blue building, that's the lab. But then the day I went to a different facility, and then I'm like, okay, where do I go? Where do I ask? What do I do? So when I thought about it, now this is someone who is she has come with a patient. She is frustrated. She's maybe struggling economically, financially. She just wants direction. So the least you can do is maybe tell them, so you go straight, then there you'll find a guard, ask them for the next point. Or if you have the time, you could just even help
Yeah.
them out. I don't know. Have you ever experienced something like that? Or for you, the doctor who, come, let's carry your things, and then take you up to where you're supposed to go?
No, I think I have had experiences in hospitals where it's a first time and I failed to find my way around it. And when you're a doctor, you you probably maybe know you can find your way because you know you're in a lab coat, so you can keep asking and all that. But when it's a patient, sometimes these days in the hospitals they actually like people who are like, don't enter here, don't go there, and some people are timid. But beyond that, what that has brought to my mind is sometimes people don't know which part to go to in a hospital. Like someone comes, maybe it's a pregnant mother, they like for you, you know that this patient should go to antenatal
Maternity,
care,
yeah.
but she'll just come and she may even not know what to ask for.
She may find herself at adult OPD,
Yeah,
seated,
yeah.
waiting.
Yeah, and sometimes when patients who are not supposed to be on our ward come to our ward, sometimes we're like, this is not my patient. Or we tell them, you go that side, you go.
And
like,
then you keep on bouncing the patient.
And the patient actually
and then they
does
get
it.
frustrated.
Yeah.
Yeah.
I think that is something that
Sub-
we do unconsciously. And for us, we are trying to organize the ward or keep things in order. Like, this is not an emergency. Shouldn't be at emergency. You should go to OPD.
OPD. But they should know where OPD
Yeah.
is. And then she reaches OPD. They're like, no, for you, you're pregnant. You should start from antenatal or you go to maternity. She goes there, they're like, how many weeks? No, for those weeks, this side.
Yeah.
So the person comes at 7 a.m. It is 11 or midday, and they have not gotten help.
I think that's a systemic problem that we
should
need
do
to
better.
think about as we set up
We
our
should do
health
better.
facilities. And
we should actually do better.
Yeah. But beyond the health facility itself, I have encountered people who call to ask for where should I go to do this particular thing. I'll just give you an example. Someone I know who, she's young, I think she's a teenager, had an experience that exposed her to HIV and didn't know where to go.
Oh dear.
I had been at this health facility for around a month, and even me, I knew like if you get a needle prick, this you go here and get tested, and then but I didn't know the procedure. And then we usually have WhatsApp groups, so I ask, okay guys, if someone is so exposed, what's the procedure for getting the PEP? I was surprised. Many people actually didn't know. So I just got me to think that health services are set up, and there's actually very, like for example, the National Referral Hospital, it has, I think, lots of services that people don't utilize just because they don't know where to go.
Yeah.
And that is not a priority, I think, for healthcare, letting people know that this is where to go when you have this thing. I don't know how we can do differently regarding that, but I hope maybe this platform will contribute to it.
I think it starts with talking about it.
Yeah.
Because if no one talks about that, I got a prick last time, I got PEP from the other place, how would you know? I think it has also happened to me in internship. I got a prick. It was at night. No, it wasn't a prick. It was a splash. I was repairing, and it was a splash. And then I'm like, now where do I go? And I asked the nurse, like, now that one you are supposed to have started from here. But it occurred to me that for all that time, I didn't know the procedure of getting that. But I think it's because we don't talk about it, because if you don't talk about how people know, you have to make it a continuation.
Speaking of systemic things, for the last 3 years, because I've been working on patient-centered care, I have noticed some small things that health facilities do differently that I think have a great impact on patients. One is a signpost that I saw at, it's a health center that had the lab tests and how long they take. I was like, oh my God. this is like so like so good, because one of the worst, if you are a patient in a health facility, one of the things that you dread the most is waiting. But if you're told how much time it's going to take,
It helps you to
it's
wait.
more bearable. But if most times just tell them wait for the lab results. But these guys had they had that urinalysis takes this time. So I was like, wow, this is it's small, but it has a big impact in a patient's life, because we know people are busy, and coming to a hospital is a big inconvenience in their schedules. So those small things, I think, make a big difference. I don't know if you've seen such things else.
No, I have actually not. I've
So
actually
that
not.
so that
And it's impressive that a health center for is able to tell patients that this is going to take this amount of time. So if it's like a blood culture, even you don't have to explain to the patient that now the blood culture cannot come back in one day or these hours, it's going to take this time, and they'll sit and wait for it. So
yeah,
those are really small things, but they
they make
change
a
a
big
lot in
difference. Yeah.
management. So I think moving forward, we would love to hear also from the patients in the next episodes. We'd love to hear from them the things that they think we do subconsciously that affect their care, because it's easier to point a finger than to look into yourself that
Yeah.
I do this and that. And then with time, we'll be able to have different patients tell us about the different stories, the different experiences, how they have been able to journey their illnesses, especially the chronic illnesses. We're talking about illnesses like sickle cell disease, hypertension, diabetes, and how they think health workers can improve their patient experiences in hospitals, so that we work together to improving quality of care. So I think for today, that will be it. Thank you for listening and coming this far with us. See you next time.